How are you? It's the week of March 1st, and this is the mental health component of our course. And I know this is a stressful week, and Julia's going to be sending out a little email sometime today that's going to let you know that we're going to extend the time for week five's assignments. We do understand that there was kind of a crunch time for midterms, and so we'll go ahead and get you on board with that. All right. So again, we're looking, obviously from my perspective. Now we're going to go in and look at from your perspective of the course. And here's the announcement page, and I'll be sending out an announcement about this lecture. What we are going to be doing is going straight into the weekly assignments right here. Okay. And yeah, the only thing that's coming up is we're going to have this March 14th, okay, midterm one. All right, so you got all week, all right, and we'll explain to you how that rolls, but just certainly put that on your calendars, okay. You did great with CT1, and CT2 is the next one coming down the pike. Once again, we'll explain everything. So let's just get into content, okay. All righty. So I'm sorry, with week 6. Sorry, I said week 5, but week 6 is going to be extended. Okay, all righty. So we're going to go into week 7. Okay, and it's a continuum. Okay, so we did a large analysis of diabetes. Okay, it is called part of what public health officials and physicians refer to as metabolic syndrome. It's a big deal in westernized countries, countries with excess actually, where there's just too much overnutrition, too much stress, high stress, working 7 days a week, not enough exercise, and this chronic age related disease, a whole trajectory of them. Is what society has to deal with. It's what you have to deal with as an individual, in your life with your parents, your grandparents, and in your future as well. And so the next continuum is diabetes is the number one, along with age. Age is the highest risk factor for getting Alzheimer's disease, but diabetes is the second highest risk factor. And 80% of all people with Alzheimer's have diabetes. So that there should kind of blow your mind, scare you a little bit, more shock and awe, okay? All right, but we're not just focusing in on that. We're also going to be discussing mental health. Certainly Alzheimer's disease is a component of mental health, but we also have, other disorders that are, oftentimes pushed under the rug, and these are clinical depression, bipolar disease, and depression is the big one. It's the one that we don't necessarily age out of. So, okay. All right, so again, we always have a PDF file that you can access right here. I'd like going into the actual website, so we'll click right here. It's going to take us into the website provided by the American Psychological Association. And this is kind of you see it's only a quick page of read, and they very quickly highlight, what are the big issues, and you look at as a psychologist, as a psychiatrist, as a mental health first responder, okay. The big challenge is as you grow older, you have these major life-altering events, loss of a spouse, loss of your friends. I've been an athlete my whole life. I've done whatever I wanted, and suddenly, I start to lose mobility and independence, And just because you look like this on the outside, you never stop feeling that 22-year-old you are right now. You always identify with that person when you fully become an adult, and that doesn't go away. And it's kind of you'll see when you interview your grandparents that they will resonate what I'm just talking about. And it's a real tough thing to swallow. This decline in physical health, and then your mental abilities. I'm not as quick as I used to be. All right. So they go through, some of the stats, and in terms of mental health, so we see that, 22% of people over the age of 55 suffer some type of mental health disorder. This is a huge burden, just in terms of your time commitment, if you're dealing with an older adult that has to deal with this, you're the caregiver, but also at a society level, okay? Um, Mental health is a very costly disorder, okay? And we do a really, really poor job as a society dealing with mental health. Most people that go to medical school do not even think about becoming psychiatrists. It's one of the most underrepresented specialties that we have in the world, and that is psychiatry. All right. We see people that are in nursing homes. Okay. 2/3 have mental health problems. All right. Um, Everything I'm talking about has been accelerated exponentially by this COVID-19 pandemic because so much of our mental health is and our well-being is really linked to our connection with other people, the sociality that we have, and there's been a complete and total disconnect with not only the members of your assisted living facility slash nursing facility, the caregivers that work there, but you think about just that once every 3 months visit from your kids or grandkids, that's been gone, and so it's had more people have been diagnosed and more people have died from Alzheimer's during this pandemic than ever before. Okay. So yeah, so we older Americans they don't have access. It's if you're looking for a profession, one of the most greatest, most rewarding profession that's out there, and it's very altruistic, is to become a patient advocate, and you become the person that gets that older adult to the doctor visit. All right. They underutilize these facilities. A big part is access. A big part is funding. Okay, like I said, no. We've put tons of money into cancer research. We've put next to nothing into mental health. Um, so, and then there's this, something that if you see yourself on the more business side of things, if you see yourself on the more political science side of things, we need collaboration, coordination between lots of different type of providers. Okay. And yeah, I think that would be something that if I was a business major, I'd be thinking about. Okay. Um, yeah, so this the lack of social support, okay, is a big deal, and it influences immunity, so it's just another nail in the coffin as to why older people have gotten such severe cases of COVID-19, infection, surgery, and recovery from surgery, which is again that's all immune function, right? They go over quickly in this article about depression, and there's we're going to see that the diagnosis of clinical depression and severe clinical depression is most significant in terms of age structure in your guys' age groups. All right, so from the 15 to close to 30, this is when your brain area, this front part of your brain, the frontal cortex, is undergoing significant development. That's why you got to really be careful. Just say no to drugs because there's major changes happening in this part of the brain that is responsible for your underlying feeling of well-being, of fitting in, of being connected, as well as the decision making and morality and all that kind of stuff. That's all right in here in the front part. So you combine that with being cut loose, like you guys are at age 18, it's no surprise that there's a lot of mental health problems. Okay. That being said, there's an inordinate representation in older people, and more importantly, there's you guys can form friends, can talk to your parents, you can reach out. Older people are isolated, and all the other things I was talking about, where you're starting to lose your independence, and you're starting to question what is it worth it, and so there's a big shift in the scale in terms of committing suicide, and so older people are the ones that commit suicide, sadly. Okay. All right, so this is again a discussion of dementia, and there's lots and lots of different forms, lots of different categories. It's incredibly debilitating, and again, it's a further loss of independence, and and when you lose your independence, you are now part of the severe dependency ratio, okay? And that falls on your shoulders. If it's your grandparent or parent, we're going to look into how that impacts you. It's a big deal. The cost is enormous. If you are going into a dementia care unit, all right, you're looking at $100,000 a year, and that's if you are well off, okay? If you're not, then you're going to be put into a facility that's not that great, okay? Okay, substance abuse, okay? People self-medicate, and it's a big issue, okay? When you're not feeling good, you're depressed, okay? Self-medication, especially with alcohol being so readily available, is the big issue, okay? And yeah, so chronic illness, of course, is a big problem. I do get depressed with the arthritis that I have and how it impacts my surfing, my other athletic abilities. It impacts my sleep, the pain that I have from it. On and on and on and on. So all these contribute to mental health. This right here is, for those of you that go into healthcare, it's just kind of a call out, okay? And it's the reality is, um, it doesn't matter what kind of healthcare specialty you're going to go into it. Who's accessing healthcare? It's older adults. Older adults, things stop working correctly and they need help. If you look at a surgeon, a cardiovascular surgeon, you're doing 99% of your surgeries on older people. Okay, if you're looking at somebody that specializes in cancer, okay, oncology, it's not, yes, there are a fraction of young cancers and adolescent and juvenile cancers, but the majority is older people. Okay, mental health problems. Again, we have Alzheimer's that just is accelerating. Okay, so all right, cool. All things for you guys to consider. All righty. We really want you guys to show some curiosity, and not just curiosity, but maybe some of you are impacted by this. And this is just a real quickie. It just shows you that if you go to the websites that are provided, so this is we want you to go in there and just kind of navigate the Alzheimer's website. And this is by the National Institute on Aging. And you can go in here, and this is really the information at the bottom. They talk about the research, and if you're interested in news and things like that, it's all good. But this is health information, okay? So you see this drop down. Clinical trials are something always to check into if you are impacted by this, because you're going to get the newest, the latest, and greatest. These are, again, the reading that is supported by the videos. This is how Alzheimer's disease progresses. Why does it happen? Okay, so these are the basics right here. You just click right here, and it's going to take you right in to the website, and it gives you lots and lots of different facts. Okay, again, just show some curiosity. And these are the biological causes. Again, open your quiz when you're doing this. I always forget to tell you guys that. And all this is provided in here. It's also in the videos. Symptoms, diagnosis of Alzheimer's disease. This is important. If you're dealing with an older member of your family and you're starting to question, you can do a little bit of junior doctoring, and then find out the best treatments. Obviously you're going to be taking this person to get diagnosed by a trained professional, a neurologist that specializes in dementia, but all really useful information. Okay, awesome. Okay. So, and then these are the two videos that back it up. Okay, we just had to put in the 2021. The statistics are going to be slightly different. Okay, for 2021 than the one that we used to have for that was for 2019. But that's okay. You guys, when you answer the quiz, you just do what you think is the best answer. All right. Same drill here. This is the underlying mechanisms. So this is a really cool video. So do watch this, and it'll explain to you inflammation. It explains the development called amyloid plaques and neuritic tangles. We actually have these growth factors that are released in the brain. They're actually all throughout our blood as well. They modulate cellular activity, but people that have excess production of these amyloid proteins, or the liver is not good at removing it, it's that two-fisted combo causes an elevation in the brain, and then they're very toxic. These little proteins are really, really toxic, and it causes the nerve cells to begin to die off. Okay, and that's the big deal. You have degeneration of the brain, and it's not like skin, kidney, okay, liver, where you lose some and you can regenerate it. Your brain, you have just a very small amount of regeneration possibility that goes down with aging. So the other one is a tangled cytoskeleton, so a cell skeleton. It is called a neuritic tangle, and it chokes off the neuron. So those are the two big um, biological entities, and so most treatments are trying to go after that. The current treatments that are FDA approved really treat the symptoms. They don't. They have a window where they sort of work and then they stop working. The big push for clinical trials is to be able to treat the underlying cause, so we can then maybe stop the disease in its tracks or slow the progression. And there's a lot of new antibody therapies. A lot of you probably are familiar with the antibodies that are used for treating inflammatory disease, like like Crohn's disease, colitis, um, uh, um, psoriasis, which is the red patchy skin, arthritis, multiple sclerosis. You inject yourself or infuse antibodies, and it stops the inflammation that is attacking those different parts of your body. Inflammation is a big deal, though. The whole reason people were getting hospitalized and dying from COVID-19 was because of an overzealous immune system that caused this inflammation, and the inflammation is what caused people to die. If the immune system has the best intention, but it can go south. Okay. Same thing is being looked at in Alzheimer's, where we're going to take antibodies and go after these amyloid proteins that I was telling you about, and hopefully reduce the progression. All right, cool. So that's the biology on that. All right. We see here, as I was mentioning, I'm just going to blow this up right here. That we see that the in terms of age of onset, you guys are at the highest risk to have major depression, right? This is 2007. These figures have not changed. Okay, um, people still will be depressed way out here, but the actual numbers reported go down. Part of it is, however, a lack of access to healthcare and people not getting out there and actually reporting it. So there's an underreporting here, but this is the real deal, and this is because your brains are forming right now as we speak, the frontal part, trying to make sense out of the world, basically. Okay. All right. So even though we see that this is the true numbers in terms of diagnosis is your age group, when we look at who's committing suicide, you see it flips. Okay, so the number of suicides, this is 2014, 1999. You see it's very consistent that it's older people. Okay, so people way out in here are more desperate. Okay, they've lost a loved one. They, like I said, are sick. They've lost their independence, and so what we can do to stop this is a huge public health cause. Okay, and we can look right here by ethnicity. Okay, we can also look by gender, and we see out here it's men. Men commit suicide a lot more so than women. Women are more likely a big diagnosis. And we look over here at this age group right here. It's about women are about threefold more likely to be clinically depressed. However, men are much more likely to commit suicide. Okay. All right, and we can see how how this ranks around the different ethnic groups. Okay, all right. So these are some facts again from 2019. So you use these facts for addressing the quiz there, and then we're going to be changing this next year. Okay. Um, we look at Alzheimer's disease. Okay, so we flipped from depression to Alzheimer's and looking at the facts, and we looked at the prevalence per 100. So that's the number of patients that you'll see per 100, and you see that it gets it's significant out here. Okay, 30% by the time you are approaching 90 years of age. Okay, you see here you're sort of approaching 20%. Okay, in your 80s. All right, so that's a large component of healthcare that's going to, as we're going to see in your discussion, impact you guys. Okay, we say that men and women, there's a disparity. All right, and This is thought and be due in part to the loss of the fertilizer for the brain when you go through menopause, and that's estrogen. Okay. All right. So we go back to what we were looking about here, the facts. Okay. So we want you to consider again these facts, and you guys are business majors. Okay. You're political scientists. Where you're going to make change. Okay. You look at these numbers. Okay. And if we could get in here and fix some of these costs, and then specifically, I'm going to highlight this right here. The cost that it has on you. So we look over here, and it's the cost of caregiving. Okay, when you are looking at a caregiver, right? We're highlighting millennials. That's the people just preceding you. You're coming right down the pipe. You're next. Okay, and when you have a demented family member, 33% major interference with their work. Okay, 14% had to completely stop working. All right. Here's a burden, 42% were the sole caregiver dealing with this, okay? And we see right here, 27 was the average age of this caregiver. So this is your guys' immediate future. This is why I want you guys to kind of take pause and think about what it is that you want to do, and talk about it in this discussion to make it better on you and your generation to help older people, okay? Alrighty. And the kind of tasks you have to do, you are the the person that is the um, the kind of interface between the older patient and the healthcare system. Okay, so this is where I was talking about health advocacy. All right, and a big thing that you're going to have to deal with. Okay, and you are going to have hands-on nursing tasks that you're going to take care of. So this is at the very least you're going to have to oversee this because you don't want to be screwed by some shyster that you pay to do this. Okay, so consider these. I want you to look at these two videos. Okay about Alzheimer's right here. So this is about the caregivers, you guys, as I was talking about. And then this is an amazing video about showing an actual Alzheimer's patient and the type of care intervention you can do that you can consider. Music therapy is huge. Pet therapy is huge. Exercise is huge. Engagement, engagement, engagement. Okay? All right, and so what we want you to do is we want you to design something that's going to make life better for you, your parents. All right, guys? Awesome. Very cool. So I'm glad you guys are taking this class. I want you to consider these concepts seriously. And guess what, man? We're gonna see you next time. So let's see here. Let's see.